you. Okay, good morning everyone. Welcome to the mental and physical safety on our roads webinar. My name's Alison Larry. I'm the Injury Prevention Officer here at Injury Matters, and I will be introducing you to today's speakers. Today we have Claire, Christine and Anna all joining us, who will all be presenting on their projects. So before we get going, I would just like to acknowledge the traditional owners of the land in which we meet today, the Whadjuk peoples, and extend our acknowledgement to the traditional owners of the lands in which people from across the state are attending. And we would like to pay our respects to elders past, present and emerging. So before we get stuck into the presentations, just a little bit of housekeeping. If you haven't already done so, please ensure your microphones are to mute. As well, can we please save all the questions for the end of the presentations? If you do have any questions, you can send them through the questions tab in the Q&A function, and we will ask them to the speakers at the end on your behalf. And we will be evaluating today's webinar as well. Once the webinar is finished and you close it down, and a link to a survey or a SurveyMonkey page will pop up. So if you can just take a few moments of your time to complete the survey, or all your feedback helps ensure that we're delivering training and webinars that are meeting your needs. So to begin today's presentation, I would now like to pass you over to Christine Smith from Injury Matters. Christine manages Injury Matters community-focused trauma recovery support services and has over 20 years experience working in senior positions in the community, health and disability sector. Christine holds a Bachelor of Science in Health Promotion. Thanks, Christine.
Thanks, Alison, and welcome to everyone. And I believe we have some people over on our eastern states border as well joining us. So welcome to you as well. Injury Matters is an organisation that we've been around for over 25 years, and we aim to prevent and reduce the impact of injury within the Western Australian community. And we do that through advocating and providing education for injury prevention, as well as providing support for those impacted by injury and supporting them in their recovery. Just a few definitions you'll see on the slides in front of what injury is. The physical or mental harm to a person resulting from intentional or unintentional contact with an object, substance or another person. Injury prevention, the actions to remove or reduce physical or mental harm, and recovery, the process of improving an individual's state of physical or mental well-being following an injury. The way that Injury Matters works is to influence, empower and collaborate. So with those key factors in mind, it's how we work with individuals, agencies and decision makers so that we can ensure that injury is a priority across all of those sectors, how we can actually assist people and empower them to make decisions that will prevent them from injury or reduce any impact of injury. And how we work together with others for shared solutions to be able to prevent injuries from occurring, and again in how we support people in their recovery from injury. All those key elements of Injury Matters as an organisation are what guide us in our programs and our principles and how we operate. We have 4 key programs that we offer. The Stay on Your Feet program, I'll go through them really quickly. There is relevance for all of these as to how it actually influences the Maps on Our Roads project. The Stay on Your Feet project, which is a falls prevention program that works with community members and health professionals on how to keep active, prevent falls and promote healthy ageing. Road Trauma Support, WA, which is a statewide service providing information, education and counselling services, a specialised service for people affected by road crashes, which is free of charge with no referral required. No Injury, which is a capacity building project that provides knowledge, training, resources and networking opportunities for health professionals, local government, not-for-profit community organisations, anyone who has an interest and a mechanism to be able to prevent injury. And then our new mental and physical safety on our roads project, which is funded through the National Heavy Vehicle Regulators Heavy Vehicle Safety Initiative. So we are grateful for the NHVR for that funding to enable us to commence this project. Before we start, again acknowledging those of you attending the webinar and across the state of WA, as well as those on the eastern border, and just acknowledging the additional wellbeing pressures, I guess, particularly to our eastern states counterparts with the current COVID situation. So recognising that, and also recognising that there may be some mental health concerns that are exacerbated through that. And we also will be talking about road trauma in a context. So we recognise that this can impact people at times, and we want to assure people that there is a support available. If there is a road trauma affected concern, you can contact us on the number or the website that's listed there, but also Lifeline on 13 11 14 for anywhere in Australia. The mental and physical safety on our roads project, we call it MAPS on our roads, aims to improve the mental and physical safety of heavy vehicle operators in WA as a means of improving heavy vehicle safety. It's funded through the Heavy Vehicle Safety Initiative administered by the National Heavy Vehicle Regulator on behalf of the Commonwealth Government. Our project began in October last year and is due for completion in February 2022. And the MAPS project aims to deliver a variety of engagement strategies to improve heavy vehicle operators' knowledge and awareness of the importance of maintaining good physical and mental health. I'm just going to show you a slide which, I'll take you through a slide which shows you our program approach and how the program came about, I guess, as well. So the project aims to improve the mental and physical safety of heavy vehicle operators in WA as a means of improving heavy vehicle safety. The project concept was informed through the target audience direct and through interactions that Injury Matters Road Trauma Support WA service had with people accessing our services, seeking additional support and information after being impacted by a road crash. What we found through those interactions of people visiting our service was that we were noticing a number of people involved in the transport and heavy vehicle industry were actually approaching us for assistance, and as well as their family members and friends. Also through our stakeholder and community engagement efforts, we were also hearing on the ground, particularly for WA having such a wide regional expansive road network, we were hearing that for many of these heavy vehicle operators, they were often the first that were coming across a crash, and at times would assist at that crash site, awaiting emergency services to respond. So we recognise as a specialised service that this actually can have an impact on individuals depending on other things that are happening for them at that point in time in their life. We also recognise as a service that it doesn't necessarily happen straight away. It can actually, in terms of the impacts and the effects that can happen for an individual, it can actually happen at any point of time, again, depending on what may trigger a memory of that event. That together with our 20+ years in working in the falls prevention area, which is working with a cohort of 55 years plus individuals, we have been working in a space that we know how to raise awareness and how to change some behaviour mechanisms of people in that age cohort. So for us to achieve those objectives, the aim, we came up with some objectives which will guide us through. and they are increasing awareness of the importance of staying mentally and physically safe, increase awareness of how to assist others involved in a road crash and experiencing mental health concerns, increase awareness of how to look after mental and physical safety after a traumatic event, and increasing awareness of when and where to seek professional help. So we recognise that a road crash can actually be an instigator, whether directly involved or not, indirectly involved as a witness, a first on scene, or a family member or friend or work colleague affected. We recognise that there's elements to that can actually impact on mental well-being of an individual, but also some of the physical aspects that as an older workforce, how that can actually impact longer term for them as well. So our target audience, primary target audience of the project is heavy vehicle operators on WA roads with a focus on 45 years plus. And our secondary target audience is the heavy vehicle industry, as well as families of heavy vehicle operators. Strategies, Maps on Our Roads project includes a variety of engagement strategies to increase knowledge and awareness, and they include information resources, so looking at some printed resources, promotional materials, website information. We'll have a mass media component to it as well, and we're looking at the mechanisms that are most effective and used by the target audience to be able to communicate those mass media through our mass media messaging, as well as education and training, and that's including community engagement, stakeholder engagement, and how we can actually get some mechanisms into the industry to be able to train others as well. Our partnerships and collaborations are really important. As an organisation, Injury Matters has experience in working with the target audience in terms of the age, in terms of the demographic. We have the experience in working in the specialised area of road trauma and in the prevention of injury, in prevention of road crashes. So we are experienced in that. And we recognise that the industry has the experience in working within the industry. So it's really important for us to work alongside industry so that we can learn the way that things happen in that space, and transfer some of our knowledge that we know working in the health promotion and mental and physical space across to the industry. And again, likewise, the industry transferring some of that knowledge for us so that we can have a more meaningful project that's relevant for people. So our partnerships and collaborations are really important, and we recognise the vast range of partnerships in this space, from the larger multinationals through to the individual owner operators as well. So we really are looking at developing a project that is going to meet the needs across all of those sectors, but importantly getting to that community level and to our target audience. Evaluation is a key part of the project. We are constantly evaluating the program. From its initial inception, it was based on evaluation practices and formative evaluation. So what that meant for us was going out and talking to people and finding out what is the real issue here. What is it that the industry needs to keep themselves mentally and physically safe on our roads. And each of our evaluation measures align with our objectives, and that will help us keep on track as how we're tracking throughout the project, but also keeps us in check that, again, that we're relevant to the target audience. The project has 4 key milestones or phases. The first phase is the planning and preparation, which Claire will talk to you a little bit more about what some of those outcomes or findings that came from that planning and preparation, and that is around identifying who our target audience is, and again, what some of the issues are in that space around mental and physical safety on our roads. Content development's in progress. Campaign delivery is in progress, and soon we'll announce a little bit more soon. And evaluation and reporting is a continual. It's just a key part of the project that we are consistently going across to. That's the background of the Maps on Our Roads project and where we're at at the moment. I'm going to introduce you to Claire. Claire's going to talk you through some of the findings that we came to through the planning and preparation. Claire leads the Maps on Our Roads project into the research and evaluation of heavy vehicle operators. And Claire has over 15 years experience working in the mental health and community wellbeing spectrum for not-for-profit agencies. And Claire holds a bachelor's degree in counselling and is an accredited bereavement counsellor. Claire, I'll hand you over.
Thank you very much, Christine, and welcome everybody. As Christine was saying, we moved on to the first phase of the planning preparation at the beginning of October, and the start of this phase was gathering the data and research and understanding really what was going on in the industry from a wider perspective, to put it into context for us, to understand any trends and gaps that there might be in the mental and physical well-being areas in that sector before we started the planning stage, which gathering this research gave us that benchmark from where we could go from. So the planning stage, which I know many of you who are listening in today supported us with, and I wish to say thank you for all your input. The planning stage on Maps on Your Road consisted of in-depth interviews and surveys, hard copy and online, and group consultations, and it helped us to gain an understanding of the profile of the Western Australia's heavy vehicle industry, what truck drivers' involvement in road crashes would have been, and their overall status of their health and issues and behaviours for truck drivers. It was an enabler and a reinforcer of truck drivers' health behaviours as well, and existing health heavy vehicle industry health and wellbeing initiatives to understand what was out there already, to give us an idea of where the gaps might be. And so in total, we went around the state, Christine, myself, and another colleague or two, and we actually held 14 in-depth industries from Kimberley, Pilbara to the southwest and the Great Southern, and also in the metro area. And we hope this would give us a broad spectrum of the factors and issues impacting or were around for the heavy vehicle industry. The hard and soft online copy of the survey was active for about 19 weeks, and the survey included questions regarding the profile and wellbeing initiatives of the heavy vehicle industry. However, we did realise mid-time frame that the hard copy survey we needed to do a hard copy survey because of some limitations with access to the online survey. So we then changed our tact and did hard copy and provided a stamped address envelope to make it easier for the heavy vehicle operators to complete and send back. And we were very pleased to receive 137 individuals participated in that consultation process. We also held one group consultation up in the Kimberley as well. So once we gathered all that data, we then took about what we call in the industry cleaning it to really understand whether it was all completely complete and to get the key findings. And I'll break this down for you as it might be tricky to see of our infographic. So the main key findings that we did find, which were underpinned with the data, research data that we gathered prior to undertaking in this planning and preparation, was there is a declining workforce. There are very few new heavy vehicle operators coming and joining the industry, which is therefore leading to additional pressures on the existing workforce. We recorded and noted that many heavy vehicle operators have witnessed or have been involved in road crashes, which often leads to having negative thought processes and feelings, and could lead to mental health issues or increase any mental health issues that they may have. We were able to recognise 2/3 of the industry do actually provide company and health wellbeing initiatives for their drivers and the families. What came up regularly through across the board was many drivers felt other road users needed more education on how to use the roads, especially when they're navigating around the heavy vehicle industry, such as overtaking, sharing the roads, stopping distance, etc. And there was a desire within the industry to have more consistent regulations across it. It was noted that sometimes some companies were asked to do some particular regulations where another one were asked to do something slightly different. So it was leading to that inconsistency and confusion, which was adding to the pressures and stresses of working with that industry. Lastly, it was noted by many, especially in the regional locations, of the inadequate WA road structures for that heavy vehicle industry. For example, there was quite often a lack of service toilets on WA roads for heavy vehicles. It was noted that there were some for more tourists, but the heavy vehicle industry, there was a lack in that infrastructure. Also, there was a limited supply of fresh fruit and vegetables available to them when they were on the road, which had an impact on their diet and that physical well-being side of things. We also found some systemic factors within the findings, such as, because of the nature of the industry, it was very rare to get many people in one location at one time. So therefore to impart particular information or just to do any team buildings activity. Also, the majority of the industry was extremely time poor. They were working to quite close deadlines, and there was quite a heavy turnover, a quick turnover when they were back in the yard. One thing I did come across when I was on site and coming through to the heavy vehicle industries and visiting yards and things were the amount of surveys that were going on at that time. So quite often when I'd phone up someone, they would say, oh, we've just completed a survey to do with this. So we gathered that the industry was surveyed fatigued. And in that survey fatigue, there was confusion about how, or misconceptions or a different perception of how those surveys results would be used going forward. We noticed because of that how important it was to do some form of feedback to everybody who took part in that consultation, and that is going to be part of our work going forward, is to feedback what we've learnt or to get feedback on what we're going to be doing with the industry. And unfortunately, during that short period of 19 weeks, we just had really high unprecedented events, such as the fires in the eastern states, which shut the air highway, and COVID, and the COVID restrictions and the shutting down of each state. This all had an impact on gathering that information and the amount of information we could have, those completed consultations that we've received. So once we looked at all the data that we've gathered and listened to the consultations, the interviews that we held, these are four of the common themes that were coming through. So these are the anecdotal comments that some of the participants said. So regarding a road crash, we heard, unless offered help at the time, where would you go? Where do they go to? And how do we find someone involved with trucks that will understand and help them? And then that general information about their role, it's a physical draining jobs, and drivers are pretty buggered at the end of their shift. So therefore, to do any additional work or learnings, they haven't got the time or the capacity to take it on board. Regarding family relationships, often it's a long distance drivers they're away for long periods of time will put a strain on relationships. And regarding the actual industry, some said that if you were given an award 1 minute, it could mean you're regulated and checked thereafter, which again, all of these points have issues to do with their mental well-being going forward. And they sort of helped us, those comments and the information we got, identify 3 areas, which again aligned with that benchmark of that research that we gathered at the onset of the planning and preparation. And the 3 areas that we had were the involvement of crash. 66.7% of the survey respondents indicated that they have been involved, witnessed, or were first on scene of a serious crash whilst they're driving at work. And of those, many experienced negative thoughts and feelings after that event, with limited support thereafter. We also identified that poor diet and physical inactivity related to their work and the infrastructures within the road system had an impact on their overall physical well-being. And lastly, the mental health concerns. 1/3 of operators could not identify a health or well-being initiative conducted by their company, with the leading mental health risks identified as being well away from home, unrealistic schedules, the stress, and then also navigating the roads with other vehicles as a stressful event. So based on those 3 areas, we have looked at developing campaigns, and each campaign will have particular resources linked to that campaign. So the resources will all have a media campaign. So over the coming weeks and months, you will on your radios be having some information about the Max on Our Road campaign and some educational awareness via those radios. Also social media, the Facebook, Twitter accounts, RE Newses, we will be imparting information to do with that. The resources are being developed to complement the media campaign and the training as in written form, and these are available for you once the campaigns have been launched. And lastly, we're going to be raising awareness via training such as today in our webinars, and we will be posting webinars over the coming months, but also we're able to come on site and actually tailor a workshop related to your particular organisation to do with the particular topics that we have here. I will just give a small caveat that if it needs a lot of changing or tailoring to meet your need, it may incur a fee, but we can discuss that going forward. So that's where we really are, and with how we've gathered all the information to actually identify the campaigns. And our very first campaign, which is to be launched shortly, is Your Map to Recovery After a Road Crash. And some data to help us inform us on this campaign, and also from our research that we gathered when in our consultation period, is within 2015 to 2019, 541 people were killed or seriously injured on WA roads, involving at least one heavy vehicle. Of 150 heavy vehicle occupants were killed or seriously injured in WA, and we've broken it down to 122 to 28. So that's quite a lot of incidents within the heavy vehicle industry, and these stats came from the Road Safety Commission. Also, fatalities last year in WA, we had 160 people unfortunately lost their lives on our roads, of which 99 were regional and 65 were metropolitan. As of the 27th of July this year, so far 83 people have lost their lives on WA roads. 49 of those are regional and 34 are metropolitan. And we know statistically that anyone involved or impacted by road trauma, 33% of those will have emotional mental health issues relating to that. So when we think about the heavy vehicle industry that we know quite a few experience, witness and encounter road trauma, it will have an impact on their well-being. So the immediate considerations that we have identified if a heavy vehicle truck driver comes across a road crash is often they're the first on scene, as Christine spoke about before. And from a remote areas, this can mean you're actually with the crash victims for several hours on your own, depending on how soon the first responders can actually get there. And that in itself is a traumatic experience. Over half the crashes in the metropolitan area were involving a heavy vehicle crash, which were involved a fatality or a serious injuries, apologies. And the impact of this can mean that your car, the truck will be impounded. And that will have an impact on the stress of having to get that load to and from. And there are also then legal implications via major crash based on that. Trucks are damaged if they're involved in a crash. Again, that means they're off the road. For many owner drivers, this means they'll lose their livelihood for that period of time. Post that crash, so once the crash has happened and if your truck is okay, say you're the witness or first on scene, and especially if you're working regionally, you will then spend a long period of time on your own without the support of others in person who can give you that additional support and be able to see how you're experiencing it, which can lead to mental health issues. However, and also considering the longer term concentration, is having those reminders and triggers of crash. Many drivers that we've spoken to do the similar route as they go through their job. Therefore, if they've witnessed, been first on scene or actually been involved in a crash, they will have that as a reminder, this is where it happened, and that will cause additional stress to them. As I've already mentioned, the isolation of the job, even if you work in the metro area, you're quite often on your own in the cab for long periods of time. And this can build up to that mental health issue and not having somewhere to express what you've gone to. We've noted that within the job, you've got additional time pressures to try and get to one location to the other because there aren't enough drivers. Therefore, that could put additional mental health pressure on you. And quite often, as an industry and as humans, we might not manage those mental pressures as well as could have been, so we can have unhealthy ways of doing that. And for the example, it could be you no longer take part in any social engagements. When you are at home, you prefer to just be on your own. You might normally drink a tinny or two or a beer at the end of the day, but this might increase and you start to isolate or have poor sleep, which will lead to poor concentration. These are all factors that will, mental health and physical factors that will impact post experience of road trauma. With that in mind, we're pleased to announce that our first campaign is going to be launched on the 26th of August in 3 weeks' time. And the campaign will consist of presentations of how to support yourself after a road crash, but also, more importantly, how to support a staff member after a road crash. We'll be having resources relating to that for you to be able to download and utilise and disseminate amongst your teams. I am finished our maps on our road presentation now, and I would like to invite Anna, who works for TransSafe WA. She's the Chief Executive. Anna has over 20 years experience across the corporate and not-for-profit environments, creating and delivering and evaluating communications flows for stakeholders via a range of media. She has worked with a vast range of people with stories, knowledges, ideas and products and services to share. Welcome, Anna.
Good morning, everyone. Thanks for the opportunity of jumping into this discussion. A little bit of information about TransSafe WA. We're a small non-profit road transport industry safety initiative. We've been operating in Western Australia since 2013. Initially established to deliver events for industry around information sharing and networking on industry safety issues. We've also expanded to start to begin to deliver some projects to complement some of the feedback and to address some of the feedback that we've had at our events. Across the last sort of 6.5 years of operation, TransSafe have delivered 23 road transport industry safety forums throughout WA in the regions and the metropolitan area to thousands of industry participants. We had the opportunity in 2016 to host a tour to Western Australia of the Australian Trucking Association's safety truck. That was a very successful campaign, and the truck was here for 8 weeks and travelled to the wheat belt, the Great Southern, the Midwest, and throughout the metropolitan area. We also, when we can and resources permitting, try and get to some regional shows with resources such as a partnership we had with Volvo and utilising their CNBC program. So we try and take that to some of the regional agricultural shows with member trucks and fleets to try to educate the general public about sharing roads safely and interacting safely with heavy vehicles. At each of our forums, we have a general discussion session towards the end, and a big theme that comes up every time is that more needs to be done to educate general road users on interacting safely with heavy vehicles. And as Christine outlined, that was reiterated in the findings, their research findings for the MAPS project. We regularly applying for grants to sort of subsidise our small income in order to run some campaigns. And the latest one that we're doing, which we launched this year, is called Give a Truck. What we're trying to do is get general road users to give a truck. So last year we received a project grant from WA's Road Safety Commission, which has helped us deliver this new awareness campaign. The first thing we did was survey our members, truck drivers, to understand what their biggest concerns were on the road. As you can see, Joe talks about general road users cutting into that gap that they leave in front of them. So that they can stop safely. As Joe said, the spot's there so that if everyone slams on their brakes, they can actually stop without going through 2 or 3 cars. Sarah, another member, one driver for one of our member fleets, talked about the aggression on the roads and people just always being in a hurry. And she says that she can guarantee around 10 close calls each day. So that's a stressful position, having to deal with that on your daily drives, is that they're on a high alert all the time, many of our metropolitan and regional heavy vehicle drivers in WA. So those discussions led to the development of 4 truck back posters based around cutting in, blind spots, overtaking and turning trucks. So we've got give a truck more space, give a truck clear vision, give a truck more attention, and give a truck more room. So these posters, I'm sorry, they may not be exceptionally clear for you there on that, but I'm happy to share these files so you can see them better at the end of the presentation. Each poster has an accompanying animation. So this is the one that goes with the cutting in front of trucks. So they were designed to be eye-catching and fun and quick, and to also draw the attention of our younger road users. So TransSafe WA are trying to roll out getting these posters onto the backs of as many of our member fleets and other fleets as possible. Currently we have them on the backs of the roughly 40 Busselton Freight Services trucks that do all the IGA deliveries throughout the state. Our member fleet Gold Star also have some on their trucks, and we're negotiating with a few others at the moment. So there's certainly opportunity there for anyone with interest to contact us. Obviously, the files, the campaign, there's no cost to any of our fleets to have these posters installed. The only cost that we ask for is the output cost, so the print cost is covered by the fleets. But we're also looking at further grant applications to try and subsidise some of that cost as well. We're strategically rolling out the messaging across social media. So by following and liking TransSafe WA, you can help us to spread these messages. We're also negotiating and speaking with all the local councils throughout Western Australia at the moment regarding the posters, getting posters on some of their council vehicles and throughout their councils. And we're aiming to try, resource permitting, to get to more and more agricultural shows with the campaign, to actually begin to speak to some general road users. And we have the support of local WA agency Roadwise to help us with that. We're producing bumper stickers for light vehicles. So at events like the Brunswick show, other agricultural shows, we'll be actually reaching out, engaging with people as they walk past, asking them if they give a truck, taking them through a series of questions, and if they do then give a truck, at the end of the conversation, they'll get a bumper sticker. So we're trying to paint the town yellow a bit in one way by getting this message out as much as we can. So any thoughts or contexts that anybody has in terms of assisting with that, very happy to hear from you. Another large project TransSafe WA has been working on since we did bring the ATA safety truck to Western Australia in 2016, became really apparent to us that WA could do with its own vehicle. The country's big enough to have two safety vehicles, safety trucks, and we would like one that focuses on the WA freight task, the sorts of trucks that people see on WA roads and the issues here in WA, that can travel around to schools and community and industry events here. We've, as of today, raised almost $700,000 towards this project. Sounds like a lot, but we need quite a bit more to get it up and running and on-road it for 5 years. As I've mentioned, TransSafe WA is just a small non-profit association. We operate essentially with one full-time staff member and a volunteer committee of management. So it's been a big task getting it to this stage, but we're determined to make the truck as contemporary and cutting edge as possible, and including virtual reality, augmented reality programs, working with some pretty cool partners here in Western Australia and throughout the nation. So we're drawing on some existing resources that already are circulating in terms of the messaging we want to get out to the general public, but also creating some bespoke new content as well too. So our aim is to have this vehicle on road next year in 2021. And there's also lots of ways to get involved with that project. Obviously, we need more sponsorship. We're looking at a way that fleets can get involved with contributing to the cost of the driver educator. So having their own member of staff that can travel with the truck, but also contributing to the actual cost of supporting that salary for a week or a month or whatever might work. And the truck will be a vehicle, obviously, for industry to utilise as well too. So we're in constant consultation with Injury Matters and the MAPS program and other agencies and initiatives to utilise as much as possible ultimately in terms of relevant toolbox talks and content that we can deliver to drivers through the safety truck trailer visiting fleets as well. So that's a little bit of information about what we're working on at the moment. Any further information that you'd like about TransSafe WA or our projects, you can contact me through those methods there. I'm happy to take any questions today. We are looking to deliver a forum again. Of course, we had to put those events on hold due to COVID, but we're looking to have a in-person physical event again on the 21st of September where we'll have a lot more to share about both of these projects. So if you want to follow our Facebook page, it's probably the best way to keep in touch with those things and link in to attend and register. That's about it from me.
Great, thank you, Anna, and thanks for taking the time to chat with us today and share your wealth of knowledge and talk about the TransSafe program with us. Just put a call out now. Does anyone have any questions at all? If you could send them through on the question and answer chat tab and we can ask them on your behalf. Okay. Well, I have a question for maybe Claire or Christine can help me out here. When you talk about co-design, could you elaborate on that further?
Sure. So our co-design approach is actually a key element to the project, and it's about us ensuring at every stage of the project that we are involving and communicating with the target audience to make sure that each component of our planning, development, design is actually going to work in that space. So it goes back to what I said earlier. We have the knowledge and the experience in working in the road trauma space and helping people in recovery. We have the knowledge as an organisation in how we work around injury prevention programs. It's how we combine that knowledge with the knowledge and experience that the transport, heavy vehicle operator industry has, the freight industry has, how we actually can transfer some of that knowledge into a different setting so that it works for them, so that it's evidence informed through research, but also evidence informed by what people are actually wanting as well. So it's really important for us at each point to be able to touch in and make sure that it is going to be it's going to reach as many people as we possibly can, and I guess what it helps us do is ensure, one, that it's relevant to the industry, the audience, and the wider community. And whilst this project is for WA at the moment, the intent is that the resources and the strategies and the resources that are developed will have much wider relevance across other jurisdictions as well.
Great, thank you, Christine. I have had a question either for Claire or Christine again from Anna, who's asked, can you provide a little more information about the radio channels that will be used to promote the MAPS program and the style of content being prepared for this medium?
Yeah, I'll go with that as well. So in terms of the radio channels that are being used, we've identified which radio outlets do have our target audience as their key demographic. So we're looking at men, we're looking at the 45-year plus, and we have lined up a popular popular radio station, mainstream radio station. There's also going to be regional stations that will have that as well. We are also producing material that will go that will be relevant for heavy vehicle industry publications, social media context as well, so that we can actually promote it through our existing mechanisms, but also how other transport industry, other media outlets can, and social media outlets can actually pick that up and run with that as well. So and that's again where it's really important for our partners, our partnerships, because they have the credibility in the industry. So where we can actually have those good quality relationships with our partners, that we can then leverage off that to be able to get that that coverage and actually get that out a little bit more. Style of content at the moment, it is a radio ad. There are some website and social media banners or graphics, I guess, that are under development. We are not at this point in time, but we are also looking at some other audio strategies. What we did learn from our consultations was that many of the operators, they listen to a lot of podcasts. So we're looking at how we can actually, that can further inform the way that we get those messages out to drivers while they're on the road for a long time.
Okay. Thank you. I have a question, well, I actually have a statement from Lachlan Benson, who said, I don't have any question, but want to say congratulations to the Injury Matters Maps project team and TransSafe for fantastic work. Great presentation. At Healthy Heads in Trucks and Sheds, we are looking forward to working with both of you as strategic partners and supporting you on these fantastic projects. Happy for you to encourage any of your listeners to register for the launch of Healthy Heads on the 18th of August at healthyheads.org.au. Thank you once again for a great and really relevant presentation. Looking forward to plugging all your good work through our channels post-launch. Regards, Lachlan.
Oh, thank you, Lachlan. You're very kind. We look forward to working with you as well.
Great. Another question as well from Migo Chen, who's asked a question for Anna. I'm curious to know how you plan to evaluate the effects of the Give a Truck campaign as to whether it actually leads to less road sharing incidents.
Yes, that's a good question. We are keeping in regular contact, and we have the ability to do that through our members, through our forums. So it'll be kind of personal contact and reaching out to them to see if they're noticing a difference in road user behaviour, and obviously looking at the statistics on the road as well too. But there's a bit of work that needs to be done in both those areas in terms of getting access to statistics. It's hard to get statistics that are not just fatalities. So we're working with a few different agencies. I'm trying to open up that a little bit more. The campaign's at early stages, so it's really important to us for it to be effective to roll out as widely as possible. And it is for us kind of a prelim, a lead into the safety truck project. So it's a first step, even though we've done little bits and pieces over the years. We're getting more strategic about the way we are wanting to see results from campaigns specifically around heavy vehicle interaction. So the actual WA safety truck, the way we're designing that and its content and the programs that we can use in that in terms of the VR and the augmented reality content will allow us to really see and report once someone goes through the programs that we're designing and learns about overtaking and some stats. We'll be able to see through their answers and decisions at the end of those programs as to whether they've comprehended and understood the lesson that they've been receiving. So we'll be able to see directly through the technology with Safety Truck the impact of those programs. And just generally otherwise monitoring the state of play. There's a little bit of time involved with getting everything up and running until we start to see that, but we're hoping, and it's very much our commitment to our sponsors obviously as well too, that we want to run a project that can be well evaluated and does make a difference. I guess that's where we're at the moment in that one. Hope that answers the question.
Yeah, great. Thank you, Anna. I've got one more question. This one's probably for Clare or Christine, for one of our attendees. What is the easiest way for people to stay up to date with MAP activities, with what MAP activities are happening?
I would say the easiest way is to look on the Injury Matters webpage and go to the Maps on Our Roads link there. We also subscribe to our e-newses, and we will be updating there, but we will also be having posts on Twitter and Facebook as well. So if you befriend us on Facebook, you will also receive updates. But if you want specific information and to talk to anyone, please contact us on the number on the screen.
I guess once we do launch on the 26th of August, obviously there'll be a lot more material that will be available on the website as well. So we encourage you just to keep checking that out. But also, if you do want to subscribe to one of our e-news, pop us an email that says that, and we can make sure that that you get that and enable you to subscribe to further e-newses. I guess the thing is too, it is that, and with Anna talking about just that importance of closing that loop again. So we do these surveys and feedbacks, and the important thing for us is getting that information back. It's all part of our evaluation, it's all part of our partnerships and collaborative approach. So opportunities such as this, opportunities such as Anna's the TransSafe forums that happen, are opportunities for us to be able to get back to the target audience as to, showing them that we're hearing them and what we're doing with the information that they're giving us, and also getting some feedback along the way. So all those evaluation practices along the way help inform the project.
And if you also want to be involved with the project, so to give us actual feedback and be part of focus groups, please send me an email at info@injurymatters.org.au and I'll add you to my list. Thank you.
Great. I think that's all the questions for today. So yeah, thank you once again to Anna, Christine and Clare for talking about both the TransSafe WA and the MAPS project, and we look forward to hearing more about them. If anyone wants to reach out, we do have the contact details there on the screen now, so please don't hesitate to reach out. And as I said at the start, once the webinar closes, a SurveyMonkey will pop up. So yeah, please take a few moments to fill that out. We greatly value your feedback. And yeah, thank you once again for attending.
Thank you.
Thanks.
Thanks, everyone.
Thank you.
Thank you.